Well, let's talk about travel and border restrictions with my next guest. Kelly Lee is a professor of public health at Simon Fraser University in British Columbia. Professor Lee, thanks for your time tonight. Look, does the Premier of Ontario have a case, or is he off base in calling on the federal government to enact tighter controls on testing for domestic air travelers and a mandatory hotel quarantine for those travelers coming into Canada at the land border?
Yes, the Premier is clearly feeling frustrated because international borders and interprovincial travel falls under the federal government. So he is right to argue that border management in Canada during this pandemic is still not where it needs to be. And so our research has been looking at these inconsistencies, loopholes, workarounds, all these exceptions that I think the Premier is observing. And really, we have a policy that's more like Swiss cheese rather than border management. So we do need to tighten up in order to ensure that we stop importing variants into the country. So there is a serious conversation definitely to be had. It's a very critical time during this pandemic. And hopefully this conversation can be had without being subsumed by partisan politics.
Yeah, fair enough. And look, we've seen numbers lately that, and you've got all kinds of numbers, I'm sure, that some of the ones I've seen that show 60% of flights linked to COVID-19 infections in April, for instance, were domestic flights. Should we be forcing anyone flying between Canadian airports, Canadian cities, to be tested before they get on a plane to travel to another province?
Well, there is an argument to be made for that, because we know that any kind of travel, from local travel to global travel, is really spreading this virus around and continuing to do so. So the more that we can ensure that travelers are not doing that, whether they're boarding a flight domestically or internationally, the better. So the problem with the testing, though, is 72 hours before is not foolproof. So, you have 3 days before you travel and you could be infected during that time. So there has to be maybe a tighter way of testing people either before they board with rapid testing, or perhaps really trying to create disincentives so people are only traveling for really essential reasons and not for holidays, for example.
Okay, what more could we be doing to deal with these measures at the borders and to try and control? Does the Premier have a point on that? He says, look, people are showing up by car, coming out of the United States, and they're crossing into Canada at the land border, and they're not being forced to quarantine. Well, they do when they're told they got to quarantine for 14 days, but they're not forced to go to a government hotel. Should they be?
Yeah, we're hearing all sorts of stories that the current policies are creating all these loopholes and so on. So the federal government needs to move closer to what we've seen as a gold standard globally. So there are a lot of countries have got this right, and we can learn from those countries. They range from South Korea and Taiwan to what we often hear of Australia and New Zealand. We can't be exactly like them, but we can do better. So that means a lot of things have to be tightened up. We've moved some way towards that gold standard, but we're falling short. So we're still taking a preventative approach. For example, we're waiting to see what happens, and then if a variant shows up, we suddenly slam on a flight ban to specific countries and so on. So that's not actually very effective. We need to be preventative. We also need to think about treating all travelers the same as much as possible. There will be exemptions, and that should be a really small number. But we really need to screen, test, and quarantine as many travelers as possible and not have, variation in terms of points of entry, land, air, or sea, whether they're traveling for essential reasons or not, or where they're coming from. All travelers should be treated as the virus treats them, as a kind of ride into Canada. Right. So we have to make sure that we screen, test, and quarantine every traveler that we can. We could vaccinate the rest, and then that way we would have a better system of management.
Just quickly to finish on this, Canadians are watching this conversation between politicians and watching federal and provincial politicians kick the can back and forth. Lots of finger pointing about who's responsible for trying to stop the introduction of the variants into Canada and how to prevent them from moving across the country. Who needs to take responsibility for that?
Well, if we could turn the clock back, ideally we would have put a lot of the restrictions at the international border. That was difficult at the time back in January. This was a really unprecedented situation. So now we're more than a year forward. We still have to do this kind of thing at different levels of government. So actually, it's not just one level of government. It has to be the federal to start with, but the provincial government has to have that complementary approach. It's a layered approach that has to be integrated across different levels of government, because all travel actually potentially moves this virus around. So when we have one level of government not really doing their job, others can't really, take up the slack. It really has to be an integrated approach, and hopefully, we're moving towards that and put the bickering behind us.
All right, Professor Lee, thanks so much for your time tonight. Great to talk to you, and take care.
Thank you, Peter.